Well, again, the history is, and I cannot remember exactly how I was introduced to Health and Hope Clinic, but here was this clinic specifically for patients that were uninsured, and they were really needing sponsorship, they were needing support, both financial and otherwise, and there was just a connection, and it was part of what I was doing with Baptist Healthcare, which the last 33 years of my 48 years in healthcare was with Baptist. And so the connection was made. I can remember we have an event every year where we bring about 500 of the leaders from Baptist Healthcare to a retreat for celebrating, for rewarding, for training and education. And we presented Health and Hope Clinic as an opportunity to financially support. So we gather loose change at the beginning of the day, and then it was dedicated to Health and Hope Clinic. And then the relationship just continued to grow. And Baptist certainly had its share of unfunded or underfunded patients. Many of them present in an emergency room setting because they don't have a physician relationship and can't afford one and have to be seen when presenting to an ED. And Baptist needed a way to be able to take those patients and put them into a medical home. And then that helps a healthcare organization keep them healthier in a more proactive, preventative way. It keeps them out of the emergency room. It keeps them from going critical and acute in their healthcare needs and out of a bed. And Health and Hope Clinic was a solution for that. And then the relationship has just grown and become more meaningful for both organizations, maybe more for Baptist than for Health and Hope Clinic.
There was never a competition kind of feel then, was it? Like Baptist, keep these patients? Walk me through that. How does that relationship develop?
Well, Baptist is in the business of providing health care. We have a physician enterprise, which is a large group of physicians and physician extenders that are employees of ours, and we're certainly out there looking to have patients in our practices. And it's a highly competitive medical community when you consider the 3 hospitals that are all very good with first-class medical staffs. It's competitive. However, what Health and Hope does is provide care to a population, and there's got to be a better way to label it, but it is a population that no one really wants in their office. They are unfunded. And of course, your physicians are looking for patients that have funding of some sort. And to be a patient for Health and Hope Clinic, you can have no coverage of any kind. So Health and Hope provides care to a population that, again, there's a better way to say it, but a population nobody wants. And that in itself offers a testimony to the value of Health and Hope Clinic.
Could you have ever imagined being here so long that it has become the key player that it is?
No. Actually, in graduate school, it just prompted a memory. My thesis was on the value of the doability of a primary care clinic using a volunteer base for providing care. And basically my thesis results were, it doesn't work. It'll flare, it'll start, but then it sputters, and eventually volunteers lose interest, or the expenses exceed the ability to pay for, or whatever. And so I went into this familiar with the results of my thesis. And Health and Hope Clinic has proven my thesis wrong, which graduate school doesn't need to know that now, but we can just keep that to ourselves. But no, it is remarkable. And I give current leadership credit for that, just the ability to put it together, to keep the passion going, to keep the interest. Again, as a volunteer, over time, familiarity kind of breeds indifference, but that's not the case with Health and Hope. It just continues to grow it and manifest it.
Can you imagine at this point it not being here?
No. again, I could talk Baptist healthcare all day long, but our goal is to become, and I think we have, essential to the community, a need that can't be without. And Health and Hope Clinic has become essential to the community.
Is it a hard sell from a donor perspective, or those who provide funding, or is it easy?
I think it comes with a certain challenge, because we think as a society, healthcare is a given right. Everybody should have access to it. Therefore, many times we think they do have access to it. And so it's really hard, I think, to get people excited about donating to a healthcare provider. I mean, it's not as sexy as other things out there. So the key to that for Health and Hope Clinic, again, is to be able to profile who the donor is considering donating to, and what would happen to that patient if Health and Hope Clinic was not here. It's a harder sell.
Is there anything that you wanted to share with us that I didn't ask or don't know to ask?
Whenever I have an opportunity, I can do a little bit of preaching, and a lot of folks have heard this mini sermon of mine, but I adamantly believe and hope that I've centered my life around it, but I believe God's created us for one reason only, and it's to glorify Him. It's to lift Him up. It's for us to be launch pad for His kingdom work. It's for us as individuals, us as an organization, to be a delivery system for His love to the world that's starving for it, and many don't even know that. And Health and Hope Clinic absolutely does that. Every day is rich with an opportunity to touch a life. And what better way to advance God's kingdom work than to take our own personal circumstances? It's our skills, talent, God-given talent. It's our financial wherewithal. It's our careers. And we use that and dedicate that to touching the lives of individuals. And then because of that touch, we leave them better for it. And Health and Hope Clinic absolutely does that on a daily basis. And it's done with the staff. You know, you can get so busy, you put your helmet on, put your head down, and you plow through the day, and you forget to look up. And if you don't look up, if you're not deliberate, you're going to miss the opportunity to see a need and then be able to step up and help with that need. And this is a staff with this organization that looks up all the time. And they never get so busy they lose their passion. Thank goodness they never get so busy they lose their compassion. And they are essential.